presentation, and it'll be by Attorney Crystal James from Tuskegee University's Department of Public Health master's program, and really privileged to have someone right here in our community who can answer questions, give us good information, and really help dispel a lot of things that are on the street, myths and things. Like they said, Black people couldn't get the virus, but hopefully any questions we can have along the way. And turn it over to Attorney James. Thank you.
Thank you very much, Mr. Trump, for having me. I'm going to try to mute the phones of everyone participating so that the background noise won't be in the recording. But if you do have a question, if you know how to raise your hand on Zoom, or when I get finished with my initial presentation, I'll unmute everyone so that if you have questions, we can kind of jump in. So I'm going to just share my screen right quick. I do have a quick presentation that I prepared, and it's called, and I've asked to really speak around the topic of real talk. How is COVID-19 impacting our communities? And I was actually prepared this presentation for the Tuskegee Housing Authority and the Movement 46. And so that's what we'll be talking about today. I am, as Mr. Trammell mentioned, I do have the pleasure of serving as the chair of graduate public health in the College of Veterinary Medicine at Tuskegee University. And we'll talk a little bit about how that is really significant with this virus, and how the coronavirus actually originated in animals and now moved to humans. And so having our public health program sit in the College of Veterinary Medicine has been key in our understanding of how this virus is not only moved in animals, but also moved in the human population. So I want to give you a little bit of background on some of the terms you may have been hearing on the news. You hear things like epidemic and pandemic and endemic. And in our public health world, what this really means is really talking about the expectation of disease in a population over a given period of time. And so when something is epidemic, that means we've got more cases than expected during a specified time period. And when it's pandemic, that means the disease has spread worldwide, which this coronavirus has done. And I'll show you some graphics of that and how it has moved all around the globe since it began, or we began to get reported cases in December. So it's called a novel coronavirus, and that just means new. And because it's not, this particular coronavirus strain is very different than any one that we've seen in the past. It was first detected in China. As far as the first reported cases, although it was deemed pandemic once more than 70 locations internationally were found to have cases, including the United States. The name of the disease, COVID-19, comes from the fact that this is a SARS family virus, and it is a coronavirus, that's the COV. And that's how the nomenclature of the disease has been designated scientifically, but it's commonly called coronavirus disease, or COVID, and it's 19 because it was discovered in 2019. So that's how you get to the name COVID-19. Coronaviruses are common in people and in different species of animals. They have been the sources of many different cold and flu-like illnesses in previous years. We have had data on them as early as 2003, but most coronaviruses are generally found in animals like camels, cattle, cats, and bats. This particular coronavirus, and when we talk about moving from animal to people, those are what we call zoonotic diseases. Those diseases are infections that can occur in animal population and be transmitted to humans. And many times, this transmission is only through the ingestion of meat or the handling of blood products from the slaughter of these animals. But what we see different in this one is community spread, and we'll talk a little bit more about that later. This particular strand of coronavirus that we call COVID-19 is thought to have originated in bats. Now, what's so different about this particular strain of coronavirus is that it has been shown to transmit from person to person. So the coronaviruses that we've seen in the past, usually there had to have some direct contact with blood or meat product of the animal in order for the human to be infected. It was not very, very little transmission from person to person, and very rarely have we ever seen this type of community spread. And that's what makes this particular coronavirus, COVID-19, so dangerous in the human population. So, as Mr. Trammell spoke about a little bit earlier, there are some myths that were out early. Some were that as soon as the cold weather comes, it's going to kill the flu virus. Well, we know from previous years that flu season actually starts when it gets colder. So we know that the cold does not kill virus. If you take a hot bath, it will not prevent you from getting COVID-19, nor will it cure it if you already have been infected. It has not been documented to be transmitted through mosquito bites. So you don't have to be overcautious about getting a mosquito bite and think that will be how you get transmitted. You cannot kill COVID-19 using hand dryers in the public bathroom. So you still need to be careful and make sure you're washing your hands for those 20 seconds and get your hands very, very clean. And if there are only paper towels available, it's not having that hand dryer is not going to cause you, give you any extra protection anyway. Okay. There are no known vaccines for COVID-19, and the vaccines against pneumonia do not protect you against COVID-19. So getting your flu shot or pneumonia shot will not protect you against COVID-19. There is no medicine that has been proven to be efficacious to prevent COVID-19. So if you heard anything different, there's just no science at this time to back up those statements. So as of today, where are we in the world with this virus? Right now, there are 1,990,112 confirmed cases. I'm sorry, that should be worldwide. That's not the I'm sorry. Worldwide. There's actually 100 and, I'm sorry, I got these mixed up. There's 112,441 deaths. That is the United States data. And 524,855 are recovered worldwide. This is from the Johns Hopkins Resource Center. And my next slide will show you a better picture of this, and I can get some of these numbers together. This is a screenshot that was taken today of United States cases as reported from Johns Hopkins, and it's highlighting the cases, the counties that have the most confirmed cases to date. And the ones that are in deeper red are the counties that have the most confirmed cases. And as you can see right down here, where you see where Alabama would be, as we have been talking about in a lot of different places, is mostly in those black belt counties, in those black belt states, you see the most red numbers. And these are confirmed by population. So this is looking at rates, not numbers, but the rates per number of people that have been tested. And as you can see, where most of African Americans are, you do see those higher rates in our state. And this screenshot actually shows you the number of the testing rates. So again, the bigger the circle and the more overlap of the circle, mean that state, and this kind of outlines the United States, how much testing has been done in the state. And again, right in here is where you see Alabama. And as you can see that we don't have, most of the state is not really covered when it comes to testing. And that's what's so critical and important about what the TM46 and in conjunction with the advocacy of Tuskegee University has been able to do, is to provide test kits and free testing for people who want to be tested. So if you have not been tested, whether you have insurance or not, you can be tested. in Macon County. There have been 2 clinics that have been conducted thus far, and I know that there are others that are planned that were actually advertised on the flyer for this meeting. So please take advantage of it, because as you can see, as large as the numbers are that we had seen, and again, that 1 million was the United States data. Now 1,990,112 confirmed cases, that's US by itself. And that's with only this amount of testing. So you can imagine what those numbers would be if testing was more widespread in the United States. Now, so what are some of the signs and symptoms of COVID-19, the disease? What CDC initially put out was between 2 to 14 days after exposure, you may experience fever, cough, shortness of breath. But what we also know is that there are many people who are carriers who are asymptomatic, which means they don't have any of these symptoms, but they actually are carriers of the virus and are able to transmit it to other people who might actually develop these signs or symptoms. Some of the severe illnesses that have been reported in relation to COVID-19. This is based upon data that was collected from China, simply because those were, they actually had the first epidemic reported. And so they had more case data. They're at a different stage of their mitigation and response. And so they're able to actually start to have some data that they report out. And 16% of the cases in China were actually severe, which means they required some type of hospitalization and or ended in death. And they were mostly among the members of the community that were elderly or had some pre-existing conditions or what we call comorbidities. Now, some pre-existing conditions that were really associated with severe illness were HIV and AIDS, people who were getting treatment for cancer, any type of cancer, asthma and other lung diseases, heart disease, as well as diabetes. Now, when we say comorbidity, what we're really saying is that you can have heart disease and diabetes at the same time, right? So you can also get diabetes and have COVID-19 at the same time. And having those comorbidity makes you more susceptible for severe illness, because it's just like at the beginning of each day, your body gets a $100 check that it can cash for your well-being and to keep your body functioning at optimal performance all day. And so if at the very beginning of the day, your body's already dealing with diabetes or dealing with asthma or dealing with cancer, it could be spending anywhere from 25 to 50 of those dollars right off the bat before it even start to try to deal with things like you walking around and moving and doing their daily activities. So your money is being spent towards that too. It has to allocate something to your actual daily activities. And that's why some people, when they get these illnesses, they get lethargic or they're tired and they don't want to do a lot of moving around, because again, out of that $100 they have for the day, their body's already spent $50 taking care of those comorbidities. Now it's trying to spend what it has left on the activities that you're trying to do. And so as it spends more of that money, and as we know in the bank account, as you get your bank account get lower, there's less things you can do, right? You know that you got to slow something down until you can get to the next morning to get that new $100 check. So that's kind of how comorbidities impact us when we get susceptible to the virus. So the healthier you are, if you get exposed, then the less likely you are to have severe illness. And that's just one way I kind of like to look at it each day. And so we try to do everything that we can to make sure that $100 that we get every day, it doesn't have to spend it on things like heart disease or diabetes. And so staying healthy in all the other ways that we talk about in public health is critically important during this time as well. So some of the stages that you may go through if you are infected with COVID-19. In that first stage, you may have no symptoms at all and still transmit to others. The incubation phase, where you haven't actually even started to show any signs or symptoms, but you actually are still very infectious. And that's why it's important. even though we don't have any symptoms, even though we don't feel bad, we need to wear a mask when we're out in public. Now, that mask is not to protect me from somebody else. It's actually to protect other people from what I may have and I just don't even know it. Because if I know I'm sick, then I'm staying home, right? And I'm isolating, I'm quarantining, doing all those other things that public health tells us is important to do if you are positive. But I'm wearing a mask in public, even if I'm not feeling bad, because I don't know. I could be in the incubation phase. I could be in stage 1 right now, and I could actually be spreading it to other people, and I don't know it. So that mask is actually protecting other people. It is my way of protecting the beloved community from me. In the second stage, you may have some mild pneumonia type symptoms, fever, cough, shortness of breath. It's not necessarily fatal for everyone. There are a lot of people, as we saw in the previous slides, that do recover. And usually you start to feel weather within 10 to 14 days of what any of these different types of signs and symptoms that you may have experienced within 10 to 14 days, just like with the regular flu, you start to feel a little better. So you want to call your healthcare provider. You want to get tested because we have testing available in Macon County now. So you want to do that so that you know for sure what your status is. But if you're having any symptoms and you have a negative test, it might mean that you haven't moved far enough along in stage 1 in that incubation time, because you can start to have symptoms in stage 1 on day 3. Again, it depends upon what are the other things that are going on in your personal body that your body might be having to spend its resources on, so it's not able to fight this fight this virus as well as other people. So what might take me or someone else 10 days to have a symptom, depending on what your comorbidities are, you might feel symptoms within 2 days or 3 days. So again, it's very different for every individual. In stage 3, hopefully no one that we know will progress to this, but if it happens, that's when you have the severe respiratory distress. People need to be hospitalized. They may have to be intubated and put on a ventilator, and it absolutely can be fatal. This is a very serious virus. It is something, even though we're starting to see these states open up, it is something that's still very much spreading, and case numbers are continuing to go up in a lot of states. So you still need to be very much aware and also doing all the things that you can do to protect yourself and the community. So we talked a little bit about the high-risk groups, but if you fall into any of those categories, there are some particular precautions I want to mention that you want to make sure that you're taking. If you're in a high-risk group, i.e. you have a comorbidity, you are 65 or older, you want to take extra precautions to keep that social distancing space between yourself and others. When you go out in public, make sure you keep away from anyone that you know that is sick, and limit contact, and wash your hands often if you happen to come in contact with somebody who you later find out is sick. You want to avoid crowds as much as possible. Definitely want to avoid cruise travel and non-essential air travel when the air is circulated and you don't have a lot of opportunity for fresh air. And also, if there's a known outbreak in your community, either there's been a significant number of people that have tested positive in your community, that's definitely when you want to try to stay home if you're in one of the high-risk groups. So if you actually are in stage 2 or stage 3 that we talked about earlier, you start to experience some of that difficulty breathing or shortness of breath, you have some persistent pain or pressure in your chest, if you're feeling confused or inability to get up, like again, that you're feeling lethargic, like you barely want to get out of bed, or you start to have discoloration around your lips or your face, you definitely want to call an emergency room, and you want to get into a hospital as quickly as possible. Again, this is not an all-inclusive list, but you know your body. If you wake up and you feel like something is off, you want to go and get checked out. Call your doctor and get somebody to, even if it's through telemedicine, or have a healthcare provider have a conversation with you over the phone. You want to get some assistance if you start to experience any of these emergency signs. So what we've gone over is, if you're feeling sick, you want to stay home, call your doctor, let them tell you what you should do next after they've heard about your signs and symptoms that you are experiencing. Definitely get tested, and so that you know your status. And so if you are sick, you know that you need to be isolating. Also, as you recover, if you're not sick enough to be hospitalized, you can very much recover at home. That's something I definitely want to talk about in our time here today. There are some things that you can do as you isolate at home and to help keep the rest of your family safe while you recover. Again, if you experience any of those emergency signs, you want to get some emergency help as quickly as possible, and call for an ambulance if you don't have someone readily available to take you to a hospital. So if you are sick, or if you found that you've been positive but you don't have any symptoms, you definitely do not want to go to a hospital unless you absolutely have to, because that's where all the sick people are. You don't want to be around take an opportunity to be even more exposed unless you actually are in an emergency situation. If you are isolating at home, if you can, you want to try to mark the eating utensils that the person that's ill is using. So you want to get them their own knife, spoon, and fork, and put a little piece of tape or something on so everybody knows that this is their plate, their fork, and those things that they eat with. You want to definitely keep them washed and separated, just because with hard surfaces, sometimes the virus can live for a very long time on them. And so as bleach and other cleaning solvents are becoming less available, or you just don't know if it's absolutely clean, you just don't want to put it with the rest of your utensils that other people be using. You want to keep those things separated and let them use their utensils during the time that they have active virus load or testing positive. If it's possible, they should be in a bedroom, a room where no one else enters regularly. Have people bring their meals to them. If it's a room where they have their own bathroom, that's even better, so that they don't have to worry about sharing those different common spaces with too many people. However, if you have a home where there's only one restroom and that person has to use the restroom that everyone else is using during their isolation time, you want to make sure each time that they use it that all hard top counters are cleaned. And you can use a bleach-based solution if you have it, 70% alcohol solution if you have it available, or you can use some really hot soapy water and just wipe down those spaces with those other cleaning things that you would normally use in your house to keep things clean. Those things will work if you wash it down vigorously and you have a good soapy lather on those surfaces. They will also help keep it clean. And you want to make sure that the bed linen and all those things that are being used by that person are only for that person. Please don't allow anyone that's not sick to sleep in the same bed with them if possible. And also you want to make sure that if you have to enter in and out of their room, that you actually are wearing a face covering and that they wear a mask while you're in the room with them, so that you can keep the exposure down from other people in the home as much as possible. Now, if you have to go in public, and we all do eventually, you're going to have to get groceries, we have to do some things. Social distancing is the most important thing that we can do when we're in a public situation. You want to wear a face mask whenever you're in public. And again, we talked about the reason why that's important. You also want to use either keep a small hand cloth, or if you use a scarf or have gloves to open doors and other frequently touched areas, especially if you're in those high risk groups. If not, if you touch door handles and those things when you're out at the grocery store, immediately as soon as you get able to, you want to use some hand sanitizers if you have it as soon as you get to your own car. But even if you use hand sanitizer, as soon as you get home or as soon as it's available, you want to make sure that you're washing your hands with hot soapy water for 20 seconds or more. The other important thing is you need to wash those cloth face masks daily. If you wear that face mask out in the public and while you're interacting, if it's not disposable, then in this cloth, you want to make sure that you are washing it. And all it takes is some warm soapy water, wash it out really good, rinse it, and let it dry so it'll be available for your use the next time. You do not want to keep using that mask over and over without washing in between. So I just want to conclude with saying this is one of my favorite journal articles, journal covers from the American Public Health Association, which many public health professionals are a part of. And it talks about here the legacy of the Black Panthers, which actually was started right here in Lowndes County, Alabama. And that legacy from a public health perspective is the legacy of our community taking care of ourselves, our Black doctors, our Black nurses and dentists, all those healthcare providers working together to take care of our community. We don't have to have a massive grant. We don't have to have other people necessarily come in to take care of us. If we listen to and attend to the messages that we trust and we know are bringing good information, then we can keep virus load down in our own communities. We can also increase the health status of our community overall. And this was demonstrated decades ago from this amazing organization that most people tend to only remember for their militant actions, but their actions around community advocacy and self-care for the beloved community are the public health legacy that they left that we are to model during this time. So, the Graduate Public Health Program, we seek to be a candle in the dark in this community, as well as other Black Belt communities that are typically underserved when it comes to health messages, as well as to having primary healthcare providers available to them. And we want to try to help bring as much resource to the community as we can. I do have some of the faculty and staff joining me on our call today. And so as we get to the question and answer period, hopefully they will chime in to answer any of the questions that you may have that I may not be able to answer for you. It's been my pleasure to offer this health educational moment for the Tuskegee Housing Authority and the Movement 46. And if we can ever do anything to assist in the community in the future, please don't hesitate to give us a call. So now I'm ready for any questions. I see there are a couple, if there are any questions you want to put in the chat, that's fine. If not, I'll just cancel out of this share and we can just get to some Q&A.
Yeah, I'd like to just add one thing, what you were saying, the group that was in Lowndes County actually was made up of Tuskegee students from the Tuskegee Institute Advancement League, and they work with Stokely Carmichael, James Foreman, Willie Ricks, H. Brown, anyway, yeah.
Oh, that's wonderful. I didn't have that piece of the history, so thank you for sharing it.
Okay. And I wanted to ask just if you could elaborate on the concept of opportunistic, in other words, how the virus is opportunistic, because you mentioned social distancing and things, and how does that relate?
Well, it is an opportunistic disease in the fact that there are a lot of different ways in which it is spread in the community. And one of the ways that I have not mentioned yet that I think is very important, so thank you for that question, is it is a sexually transmitted disease. You can transmit this virus through sexual contact. And so that is also another area that you need to take extra precautions. The opportunistic nature of the virus is that it will it replicates in its hosts very, very quickly, and it stays viable on many different surfaces and for long periods of time. And so even if you're not in direct contact with a person, if you are in contact with something that they have touched or coughed on or in some way shed the virus on, you still can be impacted or infected.
Attorney James, I would also like to add that it mutates very, very rapidly. And so from just you to the next person, it may have mutated. And so by opportunistic, that's a survival mechanism for all viruses. But particularly for this one, it makes it difficult to control. That's why we want to be on the preventative side: isolation, mask, hand washing.
Are there any other questions?
Wait a minute. Okay. Okay, this is Miss Gertha Tarver has a question.
Yes, ma'am.
Speak up. Can you?
I know about the Dept Act and the confidentiality of people and their medical history and problems should be private. But to me, it is important if you know someone who has the virus, or you know if you are around someone who has the virus. How you handling that confidentiality? Because, you know, we need to know if we are associated with someone who has the virus.
Yes, ma'am. That's a great question. And there's a process called contact tracing that every county has received some resources to try to facilitate through the Alabama Department of Public Health, which would be relevant for us here in Alabama, but in every state, where once a person has been confirmed positive, they have to have that testing has to be done through a physician. And so with the clinics that have been held in the community, there is a physician, Dr. Muhammad, that is actually getting the report back of whether or not that person is positive or not. And part of that responsibility is, if someone is positive, is to actually have that physician assist or contact the local Department of Public Health and give them that person's name and contact information so that they can contact the people that they have been in contact with recently to inform them not of the name and not of, you know, the status of any particular person, but just in general that they have been in contact with somebody who has tested positive and that they should themselves go and be tested so that they can understand what their status is. And that's what we call contact tracing. It is a very important part of how we try to flatten the curve and mitigate this disease. And so what would happen, they won't necessarily say Miss James is positive and you know she has these, she has cancer and other stuff, and so she's spread it, she's possibly spread it to you. They won't give that detail of information, but they will let you know that somebody that you've been in recent contact with, close contact with, has tested positive, and that you yourself should seek testing. Does that answer your question?
Myself, because you know some people, they're not going to always follow the rules. They're not going to always isolate themselves, and they're not going to always wear their protective gear. So some of them know that they should be alone, but they don't.
Mr. Trump, now, could you repeat the question for me, please?
Okay. She was speaking about the fact that there are people that don't necessarily follow the rules. There are people that won't self-isolate and wear the protective equipment, even though, like I said, they could be infectious or, you know, have the possibility of that. So.
I agree. That is one of the reasons why I want to do this community meeting, and why myself and other people that are on my faculty are willing to be more resource. The more we can get the word out to people and help them understand that this is something that is real, and it is something that is causing significant death around the world, and specifically in Alabama. Hopefully that they'll actually start to follow the rules more. But we have to model that behavior for them. And, you know, the more that they see other people doing it, hopefully they'll start to take it more seriously as well. but it is critically important that we get this message out to the community, especially to those people who don't necessarily want to follow the rules.
And on that point, could you kind of take it, especially on the whole concept of social distancing? Now, we know something called July 4th is coming up. And in our community, that bottle of barbecue sauce means a whole lot to us around certain times of the year. And I know that politically, certain things have been said all across the news media. I know economically, there's some things going on behind the scenes where people realize profits have been, scaled down over the last few months and things. So they're looking at that whole thing of coming out and, reopening, all those kind of things. But from a health perspective, it's almost like the health perspective has been stifled. So now, what from a health perspective and possibly even recommendations and things, because families, reunions, that goes on and on. We have a history of this. Okay, we used to take something and put it over that fire in the ground, I think, during slavery, and started that whole concept of barbecue, which I think down here we just call it Q. So what, with this perspective, what, we're social people. So.
Yes, and we are a social people, and I think that is one of the great things about our culture. But there's a way that we have to conduct ourselves in the time of this pandemic. And, the guidelines are still in place that there shouldn't be meetings, gatherings of 10 or more people. However, if there are going to be gatherings, I know that churches are starting to meet. They're meeting outside. And if you are able to be outside or in a space like you are in that community center today, where you can actually social distance and stay apart, then, if people insist on engaging in those activities, they still need to social distance in those activities. Now, those people that I mentioned that have those comorbidities and that have those other illnesses that make them their immunity be compromised, they should refrain from the 4th of July picnic and just have somebody bring them a plate, because they're going to be, again, if they do contract the virus, they're going to have more severe illness and more likelihood of poor outcomes. So even if, there are certain things that we understand that because of what's going on with me personally, I cannot participate in that, even if everybody else is. And what we see now with the social protests that are happening around the legal interventions in the community, all these things are going to continue to happen in our culture, where people are gathering, they're marching, and they're protesting, and all those things are important. But it's also important that you are actually, as best as you can, maintaining that 6 feet of distance, definitely wearing your mask, because again, that's protecting other people from you. It's not going to necessarily protect you if somebody who has disease is coughing in your face. So that's why 6 feet of distance is still important, because that cloth mask is not going to protect you if somebody sick is actually really close and coughing on you. So you have to keep all those things in mind, and you have to, as we know that people are still doing some of these social gatherings and these celebrations, we have to, again, model the behavior that we want the entire community to take. And we just have to refrain until we have a better situation. And I personally believe, even though in some states they're no longer reporting cases, or they're severely depressing the number of people that can be tested so that it looks like the numbers are going down, we know that they're not. This infection is continuing to spread. I might see that Dr. Wilson has her hand raised. Did you want to add something to that response, Dr. Wilson?
Just to add, also for the person who's hosting, you may want to think about having hand washing stations if you're outside, right? Making sure there is hand sanitizer readily available at as many tables as you can get them on. Thinking about the ventilation of the location you're going to be in. If you're outside and it's sunny, do you want to have some type of fans in that? So there's a lot of things to think about. Limiting your numbers, doing something like we're doing now, Zoom some people in. They can't come. You get at your house, have a barbecue, tell your neighbor what you make, and they make the same thing. Everybody get on Zoom and eat at your house. You can still come together in a different way, right? And if you yourself are sick or have not been feeling well, you absolutely should not go. Even if everybody else is going, we don't want the next time all those people get together to be at your funeral. Okay.
Seed has their hand raised too before we go to the next question. So it's that.
Yeah, it's me, Dr. Abdullah.
Hey, how you doing?
It's me, sir.
Can you hear me?
Yes.
Yes, ma'am. So I wanted to make a comment to your point and then ask you a question. In terms of the spreading, the numbers going up. I guess about 3-4 weeks ago, President Trump opened the economy after a series of protests by his constituency at state capitals and other places around the country, like in Arizona. And Arizona right now, their hospitals are full, over 1,000 people. They're having over 1,000 new cases a day. They've run out of not just ventilators, but the ECMO machines. And they've just moved to their crisis protocol. And you see, if you read what's going on in Montgomery has shot up, where even though its population is a smaller amount than Birmingham or Mobile, it's moving at a faster pace. And all 4 area hospitals are now involved. And they are also looking at having to deal with their crisis protocol, meaning they're running out of hospital space, and our whole medical or health system is being stressed. And we see here in Tuskegee, for a long time, our numbers were down, in the 40s and the 50s. And then just in the last couple of weeks now, we're over 100, So no, we're nowhere near done with this. We've actually entered the worst case scenario that Dr. Fauci talked about when they were asking where the 2 million number was coming from. We've actually hit areas they could not have dreamed in terms of worst case scenario. So we're seeing a rise in cases that resulted from protests that were much smaller and more contained 2 to 3 weeks ago. But now next week, the week after that, we have to prepare for huge influxes of numbers if the logics remain consistent. That being said, what I worry about here in Ridgewood is the idea, one, that children cannot be affected, and that keeps me up at night, because I see a lot of the children that used to work in the garden with me, they just running around willy-nilly, and even if they could not be affected, they could be the super spreaders. And 2, there was a rumor, as best I can call it, that was started on the internet, and it remains persistent, that Black people are somehow immune, that our aura and our melanin and blah, blah, blah. Could you please speak to that? And I thank you for your time and for taking our question.
Absolutely. I'll start with your last question first, and with the whole concept of systemic racism. I think the initial guidelines around testing were a product of the systemic racism that exists in our public health system and in this country, simply because the only people that were initially tested were those people who, A, had been in direct contact with someone who had been to China, someone who had traveled abroad in the last month or so, or someone who had been around someone who had traveled abroad, and if you had some overt symptoms, i.e. if you were hospitalized and you start having some overt symptoms. Those testing guidelines that were initially released from the CDC and followed in every state gave a skewed impression of who was being impacted, because most people of color had not traveled to China. They didn't have a family member that had traveled to China. They had not been abroad in the last 30 days. And so in the initial numbers, many people of color weren't tested. And so it gave this false sense of, oh, some Black people or brown people must be somehow immune or protected. But the simple answer is that we weren't tested. We weren't allowed to be tested in those initial protocols. So the numbers that were in our community didn't show up until much later. And as those guidelines began to change and be broadened, and that's something that I've been advocating for months now, is those loosening of those guidelines, because you're not going to have people that fall into those neat categories. And we're very clear that there are asymptomatic spreaders. And also the fact that even though young children, we have not seen a lot of deaths among young children. Again, what we talked about earlier, the comorbidities and these other illnesses that tend to show up when you get older, and people in my age category, when you get over 40-ish, you start to have more of these other chronic illnesses that show up that, again, that your body's using that $100 check to try to pay for. And so it's not able to fight off illnesses as easily as a child who doesn't have all these other things on board. But we have seen some cases where children who do have some underlying illnesses very much have some serious illness and hospitalizations related to COVID-19. So again, this bug is opportunistic. It is not going to pick and choose a particular race of people or a particular age category of people. It is going to replicate in a host or hosts that is most readily available. And it, again, as Dr. Winston indicate, it mutates so that it can survive. And so anything that we start to throw at it, this bug is so amazing because of its ability to look so different just in between two different carriers. And this is all in the same season. And that's why we have to be very vigilant about these precautions, even if there becomes a inoculation for this virus for next year. Because of the heavy mutation, it's going to be very problematic to actually get a vaccine that is going to be highly effective for everyone. So the notion that this virus would only impact certain ethnicities or certain races is absolutely untrue. Viruses have never behaved that way. I think the U.S. Public Health Service study of untreated syphilis in the Negro male proved that definitively, that a virus does not act differently based upon the ethnicity of the host in which it invades. It behaves the exact same way. And so
I have a question. I'm sorry, or a comment. This is Dr. Darnita Muhammad.
mm-hmm.
I just wanted to say that there's a lot of other factors that are involved here, especially when we're trying to decide which, not necessarily which race, because I agree with you, viruses generally don't select people based on their race. However, the comorbidities is definitely an issue. And also, not just that, but there's medications, there are an inundation of vaccines, poor nutrition, a lot of things that have followed in the Black community. And I just wanted, just to alert and warn everyone, when we're talking about Dr. Fauci and the public health department, we need to be very researched and very careful, because these entities have not necessarily led poor Black, brown, Native American communities into a sea of good health. I'm very scared to think that we are not educated, not necessarily on the corona, which we do not know enough about. We do need to shelter in place. We do need to protect ourselves, but we also need to take caution over the new medication that is set to come out, and also vaccines that can absolutely alter and damage the immune system. So I just want to caution, as we're talking about this, that we're not leading people into inoculation that cannot have been fully studied for at least, they say, 18 months, but yet they're doing trials on individuals and it's only been 4 months. And they said those who have undergone trials, they're telling the women, those who can get pregnant, to not get pregnant with the vaccine. So it's a lot of things we don't know. We don't want to mislead people.
If you heard me say that I thought inoculation was a good idea, let me be clear. That is not what I'm at all indicating. And that is why we are here today to talk about those preventive things, because I do not believe that we have ever been able to fully address any virus, not this coronavirus or any virus that came prior to it, including the flu, which even those inoculations only have less than 50% efficacy. So I'm not in any way advocating that we wait and try and put our stock in an inoculation that may come in the next few months. What I am saying is that no matter what your ethnicity is or what age category you fall into, you can be infected by this disease. Now, we have talked about, and I'm not sure if you were on the call at that time, how the comorbidities, which of course are way more prevalent in our community, do make you at higher risk for more severe illness if you do contract the virus. And
that's absolutely,
it's been heard to say,
and
clear that
yes,
that's
ma'am.
exactly what I'm saying, that we have
that's absolutely
are very much the reason why we have to take these precautions about social distancing, wearing our masks, and the other prevention strategies very seriously, because we are very much likely to have those comorbidities that will actually increase the likelihood of severe illnesses and death.
Yes, yes, thank you for that. And I also just wanted to add, it's a caveat, it's always a double-edged sword with our communities, because Time Magazine, and I can send out the article, just came out with, they said when the vaccine comes out, the Black communities and essential workers need to be vaccinated first. So they're already promoting this among our community. So I just want to put that out there. And that's Time Magazine. And also Fauci, which we just need to be very cautious. But thank you for that.
I absolutely agree. And one of the studies that we actually at the department just got funding to do through the National Science Foundation was to actually look at what are the sources of trusted information in the Black community. What do we consider to be trusted sources? Now, Time Magazine, I think it might be a good historical reflection, but would I go to Time Magazine to give me information about coronavirus? Absolutely, I would not. But there are people who will. And I think as the different companies start to get these inoculations prepared to roll out in communities, there will be a big rush and maybe even some mandates at some professions that you have this inoculation in order to have jobs. And that's going to be something that communities are going to have to make a really hard choice about, because the efficacy of any vaccine that's targeting a virus is never proven to be 100% effective, and also in some cases have had some implications of damage. And we have been, as Dr. Webb put in the comments, the Public Health Service has been talking about a vaccine for HIV and AIDS since it came out. It was discovered to be a novel virus in the 80s, and we still have not yet got a vaccine for HIV and AIDS. Now, there are some antiretroviral drugs that help boost the immune system and help to decrease the impact on the body. And I'm sure all of those things are going to come out around coronavirus as well. But it is not, I am not advocating for anyone to believe that we're going to have a magic bullet that's going to rid this population of coronavirus one day. It is going to be endemic in our population, and we're going to have to come to terms with that. And we're going to have to start to adjust to a new normal in how we actually engage so that we can stay safe.
Okay, kind of speak up.
I'm with him.
Mr. Baham, did I answer all of your questions? I know you had, I think it was 3 parts in there. Did I get all of them?
I believe you did. I was going to say too, in relationship to the mutations that Montgomery has reported, the doctors at Montgomery Baptist East, I believe, or Baptist South, one of them, have reported that the patients that they're seeing, the virus has mutated, and they say it has become much more contagious. At that time, which was about a week ago, they did not know if it had become more deadly. So I guess that's what they're watching for amongst the patients. But, you know, I wish there were more people tuned into this, because it just feels like things are about to get really ugly. And I'm really hoping that we can get our little community to begin to practice social distancing and doing the things necessary to protect themselves and one another.
Well, what we will commit to doing is I'll take the recording from this session and it will be posted on our website. I will send the link to TM46 and to the Tuskegee Housing Authority so that they can also have that link on their web pages. So for people who are not able to participate today, they can definitely have an opportunity to see the recording of this session. I think it's important that we continue to dialogue around this and to answer questions that anyone may have, and just be real honest. We, as public health professionals, even medical professionals, we don't have all the answers. This is a novel virus. It is new. We'll be still learning about it this time next year, and we'll maybe in 20 years be able to look back and have some clear understanding of how this virus acts within communities. But right now, what we know that works from other viruses that have acted similarly is that the things that we're telling you to do to help prevent community spread are the best tools that we have in our arsenal right now to try to keep people from being infected.
This is Lucinia Dunn. I don't know if you all can hear me, and I am so sorry that I'm late. But thank you all for this conversation, because I think it's very, very critical. I also want to add to the information that we as African Americans must look out for, and that is much of the cures. I'm going to put it all in one category, because folks are now beginning to advertise on television and radio about, if you just do ABC, you'll be free of the virus. But we must understand that a lot of this information that we will get is driven by money, and people will try and get your money because they want to scare you and then make you pay some exorbitant amounts of money to buy whatever that is. Also, between now and November, we are really going to get it, because our president, and I'm going to speak very frankly, our president is driving a whole profit motive agenda. So we have to be real careful about that. And sometimes on the other side of that, people want to give you something for free. And we have to be alert about what kind of free stuff we get. You know, our community is very free getting oriented. So we need to be aware of the fact that everything free ain't necessarily free. Also that the testing, I think is, and I'm going to emphasize, and I know you all have talked about it already, testing. Now, we also understand the testing has its limitations as well. So we have to put that on the table. But at least you get an idea about whether or not you are negative or positive. And I think Dr. Muhammad has emphasized getting tested more than one time because of the fact that you need to understand that you might test all right today, and tomorrow, going just outside of your door, you might contract the virus or some similar thing about that. So I just wanted to put those issues on the table as precautions as well.
Absolutely. Thank you, Dr. Dunn. We have, I did announce that we now have more available testing in the community, thanks to the efforts of Dr. Muhammad and in collaboration with TM46, and that if it's no longer a barrier, that barrier has been removed in the community, so that you can get tested. And even if you don't have insurance available, there's testing that is made available for you. And so if you hear this message and you want to be tested, then you definitely should contact TM46 or Dr. Muhammad, so that she can let you know when their next clinic will be, because it is important that as we know our status, then we know how we need to now isolate and make sure that we not only not spread it in the community, but protect our family members. We may be very healthy, but your grandmother may, you may have an elderly grandmother that you visit often, or you take care of. You need to know how you need to better protect the people around you. And so having that information about your own status is critically important.
Just to follow up on that, our testing is on this coming Saturday from 1 until 4. It will be at the pantry location on Daly or Daly Street, depending on where you're from. And we will have testing also the next Saturday. And I want to emphasize the fact that if you don't have insurance, if you don't have Medicaid, Medicare, it is also recommended that you come on. We're not charging anybody any money. I want to also give a big shout out to Crystal James, because she has really been a soldier in this whole process. She has made it possible for us to have a real dialogue between the community and Tuskegee University. And I got to give a shout out to Dr. Muhammad, because she has been there on her feet taking these tests. And we've had, I think, was it 47? She's been on her feet from 1 to 4 o'clock. And some people came late and she still took their test. So we hopefully will have another doctor out there on this Saturday and the next Saturday. I've got to work that out with Dr. Muhammad, but we encourage you to tell everybody, come on. If we don't have enough tests this Saturday, do like they have done in Georgia and South Carolina, come back the next time, and we'll make sure that we have enough tests. We have been very, very fortunate to be able to have laboratories that have accepted our specimen and have given very quick results back to our folk. And I have to also give a shout out to those people who have been working, who are lab technicians with Dr. Muhammad. They have been there from 1 o'clock until as well. So we have a good team, y'all. We have a good team. And those members of TM46 who are helping to take the information and do those things, we're giving out information. As a matter of fact, nobody leaves without some information that they can read and get to know what this thing is all about, as far as we know at this particular time. So don't forget, this Saturday and the next Saturday, we may have to do a next Saturday after that, but that depends. But what we want to do in Macon County and Tuskegee is that we have nobody that wants to be tested and can and must be tested will have the opportunity to get tested. We are not in competition with the Macon County Public Health Department. We have been working collaboratively with them, but they are stymied by the rules and regulations that they must adhere to in terms of who can be tested and who cannot be tested. We are testing everybody. I have to share this one quick story. We had a young lady, and I understand it's on Facebook, that came on this past Saturday. And I went to her car to get her information, and she was just boo-hooing. She was just crying. And I said, baby, what's wrong? What is the problem? And she began to talk about the fact that in her household, she has been the person who's taken care of her family members, all of whom had tested negatively and or had died with the coronavirus. And because she operated, you know, just looking at her, you would never know that she had been exposed in that manner. And she went all from Montgomery to Auburn, back to Tuskegee. Nobody would test her because she did not show any symptoms. And she was so grateful to be able to come on past Saturday to get her testing done. And she told her story. I asked her, I said, do you want to tell your story? She said, yes, because I want people to know that you can come and get tested here in Tuskegee, Macon County, on this Saturday at TM40, you know, sponsored by TM46.
I do
So
want to date stamp that, Dr. Dunn, because we're going to record this video. That is, next Saturday is June 13th.
that's correct.
And then the following Saturday will be June 20th.
Yeah.
And for those people who might be watching this that's not live today, they want to date stamp that so that they know that it is upcoming and what those dates are.
Yes, those dates are correct, the 13th and the 20th. Also, it's Daly Street, or Daly, D-A-L-Y Street, off of Howard Road, Tuskegee Institute. And those of you who know where the food pantry is, and I guess I better not get off this call without saying thank you to my good friend Guy Trammell, because he said, listen, don't worry about it. Y'all can come and set up here. And I have to tell y'all, not only did we get set up, but we got a fan because it was hot as I don't know what out there.
Yeah.
And so I want to thank Guy Trammell for allowing us to come and set up at the food pantry. So food pantry on Daly Street this Saturday and the next Saturday, the 13th and the 20th, from 1 until 4.
Wonderful. I think we had a couple more comments from Dr. Abdallah, and
Thank you so much. This is very, very, very good information. And thank you for serving Macon County community. The thing I'm really worried about, those people who are saying they're not believing on COVID-19. Some people that are saying that like it's kind of politics. I really don't know. And then they are going for some social gathering. Actually, last month we lost one of our Tuskegee alumni. He lost his mother, and he told me the story. He said she didn't believe it. She went to church. Right after that, she started showing symptoms, and she passed away in just a week. So how we can really talk to them that and make them understand it is true, it is fact, it is there. It can cost your life, your life, and even your loved one, your neighbor. Everyone can really get it from you if you really didn't believe it and you just behave normally, go for shopping, touching, and go to church. 4th of July is coming, and I don't know how we can reach out to those people, how we can convince them that it is facts.
That is a struggle that is not only here in Macon County, but I sit on a task force for the Black Belt, which is 12 counties. And we had our meeting this past Tuesday. We meet every Tuesday. Every county is saying the same thing. So that leads me to believe there's some kind of cultural, I'm gonna make up a word. I'm gonna wake up a couple of words here. A systemic cultural problem, because not only is it happening in our community in the Black Belt, but as I talk to other people in other states, California, New York, DC, the behavior is the same. So I am hopeful that you all, as the public health folk, can really do some in-depth analysis and research and analysis about what is going on with our behavior. Is it in fact that they distrust? Even when I say, I remember talking to this young man, I said, baby, do you realize you can die? I mean, do you know, partying and you can die from your party? Do you realize that? And he hunched down in his seat and he said, I'm not taking the test. And he was very adamant, and his mother didn't make him take the test. I mean, if I'd been my son, I would have had him, you know, by the collar and said, you know, you're going to take the test. The other young man that I talked to, and I asked him, because he was at that age that we're talking about. And I said, well, why aren't your friends coming to get tested? He said, they are afraid. I said, afraid of what? He said, I think they're afraid of what the results will be. And so, and I'm paraphrasing what he said. So I think they'd rather just go on and just party on away, because either we die by the coronavirus or we die by the bullet. That is real, real deep. And we've got to dig into this whole thing about the African-American behavior as it relates to the medical profession. Because it's not just about the coronavirus. It's about a whole lot of other conditions that we have, and we're not able or don't want to do anything about them.
Yeah, true. Thank you.
There are some heavy issues that are raised in that, and I would love to sit here and tell you that I have the answer, but I don't. That's part of the research that we're going to be doing around coronavirus in the Black community. Is why is it that messaging just does not seem to penetrate in some parts of our community, and what are the strategies that we can use to help change that phenomenon? The one thing I can tell you is that there's an organization that's actually documenting the stories like the one you shared, Dr. Dunn, about the young girl who had several family members to be impacted and some to die. That their Black ladies in public health are actually chronologizing across the country all the stories of people who tried to get tested, were denied tested, and had family members to subsequently die of COVID-19. And the number of people that have responded and have shared their stories is staggering. And I think the more we can actually share the stories about what's happening in our communities in ways that people can see and hear and feel, hopefully that will help move them and impact them to see that there are people who are of varying age groups in varying different age categories and health statuses that are actually dying of this disease every day. And the benefit that we have of being in the rural South right now is that because our housing is not stacked on top of each other like it is in some of these larger cities like New York and Chicago that have the highest per capita incidence and death rates. If they were in some of these communities and they could see the massive amount of people that are dying each day, and I promise you the news is not carrying them all, because I'm in conversation with public health people in those different counties, and they're telling me about the mass graves and the number of people that are dying in hospitals and without even someone to identify the body. So they're being buried in unmarked graves because their process for actually dealing with the number of deaths that they're seeing because of the way housing is and the inability to social distance. I think we have been in some ways put in a situation where we can kind of ignore it because we're so spread out and we don't have that housing situation. You don't see the number of deaths happening daily that you see in a more densely populated city. But it does not mean that it's not happening. It does not mean that it's not impacting our families. And there are some places that are starting to collect this information, and we will make that information available on our website as well and share as widely as we can, because we have to find a way to convince those people that the first sister was talking about earlier, about the people who just won't follow the rules and they will not adhere to these messages. We have to find a way to reach them because they impact us all.
Let's see.
There was a question in the chat. It was sent to me privately, so I won't disclose who said it, but I want to raise it. They asked if you got the flu shot, would that give you coronavirus? No, that is not. There has not been any instances that I know of where someone actually got the flu shot and they're not giving people corona. You may get exposed to it in a place where you got a flu shot just because somebody in there had it and you got exposed because they were not wearing their mask, but it wasn't because they got the flu shot.
I'd like to add something, please. Concerning our Black race, when it comes to new things, it's not that we are not exposed to the information. We have the information, we just don't use the information. We have a deep-seated suspicious group. We're suspicious of new things. And I've had people tell me they're not going to take the test for the coronavirus because it will give you the virus. The test will give you the virus. So they're afraid to take the test because they're afraid they're going to get the virus. So it's not that we don't have that information. It's how we use the information. Our deep rooted fear is fear. And not just fear, but majority of the time, we just don't care. And that's one of the main problems right there. And that's what we got to work on, because we got to find a way to let those people know about their insensitivity, how it's impacting others. They have this information. We just need to use it.
Well, I will speak to that, and maybe Dr. Muhammad, who's still on, may want to speak to that as well. But I think in the effort that we're making to try to have a trusted community group sponsor the testing, have a trusted physician of color who is actually conducting and running these clinics. Hopefully it will dispel some of that notion or fear that somebody is giving them the virus through the testing process. That is why it's so important that public health actually operates through community groups that are already engaged in the community, so that there's that level of trust there. And hopefully so that those people who might think that there would be people who would want to do something nefarious to them in that manner, that because of the people who are sponsoring and who are actually providing the testing to them, that they can trust those people, and therefore they can trust that source of getting tested.
Okay, attorney.
Mm-hmm.
Crystal?
Yes, I
Yes,
can hear you.
absolutely. And I know, okay, the trust issue is very big. And, you know, all the things everyone's asking about, or that maybe the community is thinking, those are really valid. You know, do I get the corona from the test? You know, can the flu shot, was it laced with corona? These are things that even physicians have asked. And actually, I'm working at another place, and they're actually doing the flu test prior to the corona test. Now you have to ask, well, wonder why they're doing that. So that just tells me that either the medical community doesn't even know, or symptoms. We just don't know. They don't know yet. But anyway, that's all.
Dr. Muhammad, you're kind of
That,
fading in
and we
out.
have to make sure that, and what attorney. Oh, am I fading out? I'm sorry. Can you hear me now?
Yes,
What about now?
yes.
Okay. That
And then it went back out. I don't know.
okay. That our community attorney, you mentioned that the comorbidities, the options. Can you hear me?
Yes.
I'm not a good location. Okay, but we're not getting any healthcare options, even if we're positive or negative with these tests. So those are things hopefully we can address too. I might have faded. Sorry about that.
No problem, but thank you for
Okay.
your response. And I think that's, you know, one of
Okay.
the efforts that we make as a part of the Department of Graduate Public Health, is that to be connected to community organizations, and to try to build trust, because we know that is an issue in our community in regards to not only testing, but health messages in general. And we want to be a part of the trusted sources. And so as we grow and develop, we are still a young program, but as we grow and get more reach in the community, we hope that we will be able to help put some of those fears to rest. That's what the Bioethics Center is there on campus for, is to try to make sure that we're looking out for ethical concerns that are related to research in general around the country, but specifically though research that is targeting people of color and African Americans, so that we will lift our voice. If we think that there's something that's problematic, the one thing that you can count on the department to do, as long as I am in charge of its administration, is that we'll tell you the truth. Are there
Steve
any
had a
other
question
questions?
about antibody testing and how we would get that in our community.
Well, antibody testing has not been made readily available in the community because there hasn't been a big push through different healthcare providers, first of all, to cover it in a massive way. And then there's not a lot of efficacy yet in some of the testings that are available. And I think that's why there's some lag in insurance companies wanting to cover the cost. And so at this point, even if you test positive for antibodies, it's also not clear that you still can't be reinfected with a different strand because of what we talked about earlier with the the large amount of mutation that this virus has shown just in this one season, that even if you have antibodies, you may still be infected again. So knowing what your current status is critically important.
Correct.
Are there any other questions?
No.
When it comes to any type of illness, one of the first things we need to look at is nutrition. And that's just one of the things that, we are mentioning too much, because the better immunity system you have, the better your case of recovering from any disease, not just the coronavirus, but any disease. So I'm advocating that you build up your immune system. Eat a healthy diet. Get fresh air. Don't just quarantine yourself in the house. Go outside. Get exercise. Drink water. Get plenty of sleep. All these things will add to your recovery of the coronavirus. And I can't address good nutrition enough, because that's your basic key of recovery right there. That's what your body's going to need to recover. Good immunity system. And that's what the media or anyone else is not telling you today. You will recover from most anything if your immune system is intact.
You're absolutely right. And you actually took my summarizing statements. I don't even need to do that. That was excellent. Not only nutrition, but getting proper rest and taking care of yourself. Like you said, plenty of exercise. Even if you are in isolation, you can still go out and walk in the neighborhood. You just need to not be around other people, but you still need to take care of your body, take care of yourself. And so what she talked about, and I'm sorry, ma'am, I don't know your name. I'm going to definitely find out before we get done with this call, because you have asked some excellent questions, and you definitely hit all the summary points that I wanted to hit as we close this, because we not only want to just be looking at how we can stay safe from coronavirus, we want to see how we can actually optimize the health of our community holistically. And part of that is good nutrition. And the reason why I was so encouraged to see on the flyer that people who came to participate actually on site today at the community center will get some fresh vegetables from the food pantry to take with them. So fresh fruits and vegetables, we have some great agricultural resources here in the South, in the farmers market that is available. We should definitely be taking advantage of those things, because the more we could do to have a healthy body, and as I indicated with the analogy with the $100 check, the more of that $100 check we can actually be using to fight off things like viruses, if we don't have to use it to take care of our bodies because we're already still sick or not well nourished from the beginning of our day. So that is excellent. That's all I wanted to share today. And if there are not any other questions or concerns, then I'll give it back to you, Mr. Trauma, and thank you so much for the opportunity to share.
Okay, well, want to thank everybody for being online. Thank you, Ms. Linda Simpson, for allowing us to use the facility. And again, thank Attorney James.
Thank you, Linda.
Yeah, go ahead.
Yeah, I was just saying thank you, Linda.
There you go, yeah. And also for the Movement 46 to help us get the word out too. And also Ms. Gloria Person for taking these, making sure everybody knew about this. So I think we do have, if I could do this right, we do have other people around the center here. So we did get them in, even in the rain. So thank you very much, and hopefully we can do this again on some other issues, and we'll stay in touch with Attorney James. Appreciate that so much. Thank you. Thank you for everybody.
Absolutely. Thank you.